A very good afternoon and welcome to our session on what happens during an IUI cycle. We are glad to have our expert doctor Aradhya Achuri talking about it in detail. The doctor will help us understand this topic very briefly today. If you have any comments, if you have any doubts, comment below, or you can also ask after the broadcast from our Apollo experts. We are open to questions. Doctor, you have the stage.
Hello everybody, I'm Dr. Aradhya Achuri. I'm a fertility specialist at Apollo Kondapur, Hyderabad. Today I'm going to be discussing about IUI, what exactly does happens in an IUI cycle, who require an IUI and what do we do when an IUI fails. Then I'll also be discussing about some of the doubts which my patients have forwarded since yesterday over Instagram and Facebook as well. Some of the common doubts which I'm sure many people are going to have. So let's start with what is an IUI. IUI is intrauterine insemination. It means sperms are placed directly inside the uterus. This happens around the time of ovulation. Why do we do it? Because this reduces the time and distance the sperm have to travel so that there is increased chance of fertilization and pregnancy. The hoped for outcome in an IUI cycle is to help the sperm to swim into the fallopian tube and fertilize a waiting egg. This can help in increasing your chances of pregnancy. Depending on the reasons for infertility, IUI can be coordinated with your normal cycle or with fertility medications. This is a simple and painless procedure. It hardly takes around 2 to 3 minutes, and after the procedure is done, you are asked to lie down for 10 to 15 minutes. This is cheaper than IVF or ICSI and has a success rate of 15 to 20% depending on the clinical condition of the patient. This is most commonly used in couples who need donor sperm. When it is a case of azoospermia or the husband uh, has another infectious diseases which will prevent us from using their semen, we can get sperm specimens from a certified labs. This is thought before the IUI procedure. This sperm is directly deposited into the uterus of the woman when around her ovulation time. Unexplained infertility. IUI is often performed as a first treatment for unexplained infertility along with ovulation induction. Endometriosis. In a case of minimal to mild endometriosis, we give ovulation induction medications to obtain a good quality egg, and then IUI is performed at the time of ovulation. Mild male factor infertility. When the husband's semen analysis is done and we see that the number of sperms are less, or there is weak movement, which is known as low motility, or there is abnormalities in the sperm size and shape, which is low morphology, IUI can help in increasing your chances of pregnancy because there is less distance the sperm has to travel. So even if the motility is low, there is chance that a good moving sperm can reach the egg and fertilize it. Semen preparation during IUI procedure helps separate highly motile normal sperm from those of lower quality. Cervical factor infertility. Cervix is the opening of the uterus which protrudes into the vagina. We can see that this is our uterus, tubes, ovaries. This is the uterine cavity. This is the cervix. This is the opening through which the sperm travels inside the uterus. This is the vagina. For some people, because of chronic infection or procedures which can cause scarring like a biopsy, or they had to go for if they had chronic vaginal discharge, they had to do some treatment to the cervix. When there is scarring, it increases the thickness of the cervix. This can reduce the cervical canal so that there is impediment to the sperm to swim inside and reach the egg. For some people, the mucus which is produced in the cervix is too thick. Normally, cervical mucus is normal, but at the time of ovulation, this has to become thin and stretchy. This will allow the sperm to swim inside. For some people, when this does not happen, the cervical mucus is too thick. Even though everything else is fine, the sperm will not be able to enter the cervix and into the uterine cavity. In such conditions, what we do is the catheter is passed, the IUI catheter is passed through the cervix into the uterine cavity. So it doesn't matter if your cervix is too thick or your cervical mucus is too thick. The sperm is already inside the uterine cavity. So in these cases, doing an IUI will improve your chance of pregnancy by a lot. Ovulatory factor infertility. But for some people, they are not able to ovulate. For some people, they cannot ovulate on time. For these people, usually we prescribe ovulation induction drugs. But if you're not able to conceive even with these drugs, doing an IUI can help in improving your chances of pregnancy. So, what are the steps? What happens when you come to the doctor for a IUI session? First visit would be on your day 2 or day 3 of period, but it can be started mid-cycle if you're going for a normal cycle IUI. And even if you're going for ovulation induction, we can start any day before day 5. So these tablets or injections are given depending on your condition. This helps in your ovary to respond and make a good quality egg. When there are poor semen parameters, we try for multifollicular growth. This is to increase the egg sperm ratio. So if you have one follicle growing in one ovary and another follicle growing in the other ovary, we hope that the sperm can go and meet either at least one of the two eggs which are released. Then comes follicular study. Ultrasound is done starting from day 8 to day 10 of your period. So again, which is the day 8, when your bleeding actually starts, that is day 1. Spotting is not counted. When you see actual blood on the pad, that is when you consider as a menstrual day 1. So if you count from that, day 8 to day 10, depending on your condition, the doctor will ask you to come for an ultrasound. And why do we do this ultrasound? To look at the ovaries. If there is any response in the ovary, what is the size of the follicle, what is the size of your endometrial thickness as well. So this will help us in planning your IUI. So 2 to 3 scans for some people, hardly 1 or 2 scans, depending on again your response. How fast is the response? So we keep doing scans till we see a good sized follicle between 18 to 22 mm. This is when we give the Hcg trigger. Hcg injection will help in the ovary to ovulate as well as to time the IUI. So many people have this doubt. Why do we need to give this injection? So if I am not giving this injection, I don't know when you are going to ovulate. It could be midnight, it could be evening, it could be afternoon. We don't know when the ovulation is going to happen. So this trigger injection will help us to time it. And why do we need to time it? Because the egg is fertilizable only for 12 to 16 hours after ovulation. So the closer you are to the time of ovulation, the better is your chance of success. So this Hcg trigger will help us in timing the ovulation so that sperms can be introduced inside the uterus close to the time of ovulation. This is a simple injection, very tiny needle, doesn't hurt at all. It can be given to your tummy. It can be given to your back. If you don't want to take it to your tummy, you can take it to your hand as well. This is a small injection which has zero side effects, and this will even give a good luteal support, which is pregnancy support. So yeah, you have taken your Hcg injection. What happens next? 36 to 40 hours after your Hcg injection is when we can expect the ovulation to occur. So you are supposed to go to your hospital at this time. During this procedure, you are made to lie on a table or a bed. A small speculum is inserted into the vagina. And this is the vagina. The speculum will help in opening up the vagina so that we can have a look at the cervix. Iui Capture is a very thin catheter, barely the size of a refill. Okay, this catheter is introduced into the uterus through the cervix, and once we are inside the uterine cavity, the husband washed sperms are injected directly into the uterine cavity. This is going to be between zero point 0.2 to zero point 0.5 ml. That's it. So you are not even going to feel that something has entered into the uterus. It's 0% pain. So before the IUI is done, you will be even shown the vial which contains your husband's sample along with your name and your husband's name written on it, so that you can be sure that there is no mix and match. I'm sure following some movies recently released in Bollywood, this is a very frequent question we are asked. So, yeah, there is no mismatch because only one semen sample is processed in the lab at a time. So, even if there are 10 IUI scheduled for the day, we make sure that only one person is going into the semen collection room, only one sample is being processed in the lab so that there is no mix and match anywhere. So once this is done, the sample is pushed, you are asked to lie down for 10 to 15 minutes. After that, you can go on and get dressed and go about your usual daily activities. So when do we know if it's a success or not? After 2 weeks after IUI is when you are asked to do a at-home pregnancy test. So what if you don't get pregnant? You might try IUI again before moving on to other fertility treatments. This is suggested for 4 to 6 cycles depending on your age and your other causes of fertility. So, coming to some very frequently asked questions by the patients, what affects the success rate? Age. Any chance of pregnancy, age is the first factor which we take into consideration to determine the success of the treatment. Then comes the semen parameters. Count, motility, morphology, all of them play a very important role in knowing the success. At least 10 million motile sperms are required to give a good success rate, but we have seen patients who have conceived with even 6 million, 5 million. It depends on how the motility is and also the morphology. Again comes to motility. Sometimes when the motility is too low, we can pull samples like 2 or 3 samples if the husband is able to give, so that we can put in more number of sperms inside the uterine cavity. Then comes a cause of infertility. So if it's a case of unexplained infertility or a cervical factor infertility, IUI will give you a good success rate. If it is because of endometriosis, IUI is not suggested for so many cycles. We hardly prescribe 2 to 3 cycles of IUI before we move on to IVF. So does it hurt? Does IUI hurt? Does this procedure hurt? Not at all. It's just like your ultrasound. Like, do you feel the whatever discomfort you feel when we put the probe inside the uterus? The speculum which goes inside your vagina is almost the same thickness. Only discomfort you will feel is when we open up the speculum to look at the cervix. It hardly lasts for 15 to 20 seconds and it's definitely bearable and not at all painful. How can you make it painless? What can you do from your side to make an IUI procedure painless? So, for some people, we can see that this is the uterine cavity and this is the cervix. For some people, the cervix is angulated. It means if the if the uterus is like this, your cervix is bent over the uterus like this. This is when doing an IUI becomes painful because we have to keep moving your cervix, pull it with this Alice forceps to make it straight so that the catheter can go in easily. Having a full bladder in such cases can make your cervix straight on its own so that the catheter can go in easily. So, what you can do from your side is definitely be more relaxed. Keep your thighs apart. Don't be tensed. Keep taking deep breaths and come with a full bladder. Any side effects? So the only thing we are doing in an IUI apart from a natural cycle is that we are bypassing the cervix. That is it. Nothing else we are doing from our end. So when you have normal intercourse, the sperms are deposited in the vagina. From here, they have to swim into the uterine cavity, enter that tube, and meet the egg. So this is how far the sperm has to travel on its own when you're trying naturally. In an IUI, the IUI capture is inserted into the uterine cavity till here, and the sperms are flushed into the uterine cavity. So you can see that they're very, very close to the fallopian tubes. So that the distance they have to travel comes down drastically. So if the motility is less or the cervical mucus is not good enough, this helps a great deal in increasing your chances of pregnancy. prerequisites. What do you need before you go for an IUI? So, uh, viral markers which are HIV, HbSAg, HCV, VDRL are to be done before we take any semen sample inside our lab. It could be for semen analysis, it could be for IUI. So, you definitely need to carry this test when you're coming for an IUI. What else do you need? So definitely you should have been on your folic acid treatment, and whatever your doctor has prescribed, and you should have taken your trigger on time, because we need to know if you have ovulated on time or not. So once you come into the center for your IUI, we do a scan, make sure you have ovulated, and then the IUI is carried out. Post IUI care, nothing. You just have to take the drugs whatever the doctor has prescribed. You don't have to be on bed rest, you don't have to stop your workout. If you're somebody who is working out, you can definitely work out. You don't have to take leave from your work. You can definitely keep doing every single thing which you have been doing every day, because again, the only thing we have done is bypass the cervix. Everything else is happening in your body naturally, as it always does. So next question is, what can you do to increase your chances of success? So we are giving the drugs, we are doing this from our side. What can be done from your side to increase your chances of success? Definitely better lifestyle. Avoid smoking, avoid drinking, don't take any drugs without informing your doctor. Like if you're somebody who is having chronic pain and you're taking painkillers without informing your doctor, some painkillers which taken at the time of ovulation can prevent the ovulation can happening by reducing the prostaglandins available. So if you're taking any medicine, please make sure that you're talking to your doctor before you do it. Have a healthy lifestyle, eat more green leafy vegetables, take more protein in your diet, reduce your stress levels, which should be the most important thing you should be looking at, because more stress can reduce your chances of pregnancy by causing hormonal imbalance. And then make sure you're working out or doing some physical activity at least half an hour a day, at least 5 days a week. This is what you can do from your side to increase your chances of pregnancy. So when is it better to decide to go for IUI? So IUI usually is prescribed as a first treatment modality when there is male infertility detected. If it's just ovulatory infertility, we definitely go ahead and try ovulation induction and ask you to try at least 4 to 6 cycles of ovulation induction and timed intercourse before we go on to IUI. If it's a mild endometriosis, again, IUI would be our first modality of treatment, because the egg quality is a little less when we are dealing with endometriosis, and we don't want to waste too much time, because if the endometriosis gets more severe, it will decrease your chances of pregnancy. Whom else can IUI be done? So we frequently see people who don't want to engage in intercourse, who can't engage in intercourse. So for both this category of people, IUI can increase your chance, can help you get pregnant. So, for people who don't want to engage in intercourse, the most common cause usually is vaginismus, which is treatable. You don't have to live with it throughout your life. There are counseling sessions which help. We give you dilators which help you in getting more confident with your body and which will reduce your fear of intercourse. And for people who cannot have intercourse, usually which is because of erection issues or ejaculation issues, most of these are correctable as well. You just need to talk to your doctor and see if it is something which can be corrected. There are some drugs which can help with both these conditions. If they are not helping you so much, you can definitely go for IUI. When to move on to IVF? You have tried couple of cycles of timed intercourse with ovulation induction. You have tried couple of cycles with IUI, they haven't worked. Then yes, IVF will help you in knowing Where exactly is the issue? It could be because of the egg quality, or the sperm is not able to fertilize the egg. Only with only when we do IVF or ICSI, we get to look at the gametes, which is egg, to know the egg quality. And only after doing ICSI, where the sperm is injected directly inside the egg, we can know exactly where is the issue. And if the fertilization, embryos, and all fine, your success with IVF is around 45 to 50%. It's a case of moderate to severe endometriosis. Again, we would advise you to go for IVF. Severe male factor infertility, 1 million count, 2 million count, 0% mortality, very poor morphology. Definitely, IVF will increase your chance of pregnancy. Tubal blocks or tubes have been removed because of some issue. IVF is the way to go. Medical history of pelvic adhesions. So, if you had some surgeries in the past which could have caused pelvic adhesions, like you had a appendectomy, or you had a tuberculosis of abdomen, or some other surgery you had to you had an ovarian cyst in your childhood, and post that surgery there could be some adhesions. All of this will impair the ovary and fallopian tube relationship. So even if you're ovulating well and the tube is normal, sometimes the egg which is being released by the ovary may not enter the tube. So in these cases also, IVF can definitely help. So one more question: is IUI same as normal pregnancy? Definitely 100%, there is no doubt, because everything else is still happening in your body as it does in a natural cycle. Once again, the only thing we are doing in IUI is bypassing the cervix. That is it. The sperms, instead of being deposited in the vagina, are being deposited in the uterus. The sperms still have to swim inside the tube on their own. They still have to fertilize the egg on their own. The embryo which is formed still has to come back, implant on its own. Everything else is happening naturally. That none of that is in our control. That is why the success rate is 15 to 20%. It is not 100%. It is definitely the same as a normal pregnancy. You can still have a normal delivery. The everything else is followed up as a normal pregnancy. Is it safe for overweight women? So IUI has again no difference between a normal pregnancy. What is the issue we see with overweight women is, again, there may be risk of pregnancy, hypertension in the pregnancy, diabetes in the pregnancy, risk of miscarriages. This is the reason we ask you to lose weight if you are overweight. But if I had a patient who was 106 kgs, who conceived in the very first attempt without any problem and delivered a healthy male baby. So even if you're overweight, if you're taking good care of your diet, you're being physically active even during your pregnancy, your thyroid and sugars are normal, it will not make much difference with a person who is at normal versus overweight. Does IUI medication given from day 2 and injection dose make you obese? No, not at all. These medications are all short acting, and that is the reason we have to keep giving you them again and again, because they're short acting. They can't make you obese, but they can make you obese because if you think they're taking treatment, you need to take rest, you can't do physical activities. That is when this problem comes, but doesn't come because of the injection. Even for somebody who is going for an IVF pregnancy, we ask them to be physically active till the day of embryo transfer. And even after embryo transfer, we usually don't advise bed rest. So this, so yeah. So apparently, she has seen in somebody who had an IVF treatment and they gained over 15 to 20 kgs. This has got nothing to do with IVF. Many people, because they have gone through a very difficult journey, they're very scared of doing something which can cause them to have a miscarriage, or which can affect them pregnancy. So many people stay in bed rest throughout their pregnancy, or as long as they're in treatment. This can cause weight gain, but not the medicines. So as long as you're physically active, you're following whatever the doctor says, you're keeping your diet in moderation, and you're avoiding junk food, this should not cause weight gain. So, one more question. Will IUI be successful in unicornuate uterus? So, if it is just an isolated unicornuate uterus, it should not cause infertility. The only risk with unicornuate uterus is preterm delivery. But we did see many people with unicornuate uterus who progressed till 32 weeks as well. I have seen a lady who delivered at 28 weeks, but the baby was absolutely fine, didn't even require NICU admission. So it depends on what care you are getting in your pregnancy, and again, what are the other parameters which are in your pregnancy, like if you had diabetes or hypertension or anemia or something like that. So unicorn in uterus as such will not cause infertility, it can cause only preterm delivery. If your unicorn uterus is associated with only single tube, so some people have only one tube, some I have seen patients who had only half the tube. So it is something anatomical which they had since their birth, which cannot be corrected. But even if you have one tube which is functioning properly and you're ovulating on that side, this should not impede your pregnancy. So, for many people who had a previous ectopic pregnancy and a tube had to be removed, or there's a single tubal block, or they didn't have a tube, what we try to do is we give you medicines to make sure to help you make more follicles. So, even if you have two follicles on this side, two follicles on that side, and you are ovulating on this side, you can definitely get pregnant again. I think that is it. So these were some of the questions many people asked me to talk about when I asked them to raise some queries to discuss in this live session. So if you have any more doubts, please post in the comment section so that we can talk about that as well. So I just want to summarize by saying that IUI is a very simple procedure, doesn't hurt at all. None of these medicines have any side effects. You talk to your doctor in detail about what you're expecting with your treatments and what are your fears as well. It has a success rate of 15 to 20%. We have seen many people with multiple failed induction cycles who conceive in their very first attempt. So it could be a cervical factor, it could be unexplained infertility. But yeah, it does help a lot of people who conceive, who have been trying since quite a long time. So you should definitely not be scared of going ahead and getting an IUI cycle. It's very simple and safe. So if you have any doubts, please post in the comment section. Thank you. So, are there any doubts from the audience? Do we need to talk about any questions? So, one question which I can see here is what is the cost? So, in Apollo Hyderabad, the cost of IUI is 10,000. So, I think that is it. Hello.